The context is to look at complication rates within patients who have mechanical heart valves and compare them to patients who have tissue heart valves, and in addition to that, to compare them against the rest of the registry. In other words, patients who do not have prosthetic heart valves but who have gone through a pregnancy with structural heart disease.
And what we found is that a lot of complications occurred, and these women are really high-risk patients. And what we found is that patients with a mechanical valve going through pregnancy without a severe complication and delivering a healthy child was only 58%. So that is really a very high complication rate. And we think that therefore these patients should be cared for in specialized centers by a multidisciplinary team of specialists.
We included in our meta-analysis more than 10,000 patients drawn from 13 studies. In our meta-analysis we found that transfemoral aortic valve implantation seems to be protective in terms of mortality reduction, both early and midterm mortality. Moreover, we found that the peri-procedural bleeding and stroke rate in transfemoral patients was significantly lower. This means that transfemoral aortic valve implantation is probably safer than transapical aortic valve implantation.
The question was whether diabetic mellitus has an impact on the outcome of TAVI. Despite a very severe and a more severe clinical profile than non-diabetic patients, what we observed in this diabetic population that the risk of aortic regurgitation post-procedure was much lower than in non-diabetic patients, and the clinical outcome at the end was at least as good. To be a diabetic patient does not add an extra risk to the procedure, and that basically indeed diabetic patients are very good candidates for TAVI and most likely better candidates than for surgical replacement.